Well, we're at 4th Avenue Medical Aesthetics today, watching some really interesting procedures take place. Jacqueline, the owner of the place, is going to be giving us a little bit of a explanation on what happens here. And if you're a newbie like me to this kind of world, you are going to learn a lot of information. So make sure you stay with us. Okay, Jacqueline, we've got patient number 1. What's happening right now?
So Michelle's receiving a treatment called Morpheus 8. So what it is, it's microneedling radiofrequency in 1. So this is our gold treatment here at 4th Avenue.
Okay, gold standard, I like it.
100%. So we actually do this treatment every single day, multiple times during the day. So what it is, it's microneedling and radiofrequency all together and combined. So you don't have to get 2 separate treatments. So what it's going to do is going to resurface the skin. It's going to decrease fine lines and wrinkles, pigmentation, and it also decreases subcutaneous tissue and tightens the skin. So essentially what we try to tell our patients is it's a facelift without getting a facelift. This is the closest you're going to get to it.
I would assume that a facelift is obviously a lot more intruding. Now, the aftercare for something like this, when you come in and get this done, your skin is going to be firmer, tighter, you're going to look like $1,000,000, but I'm assuming there's going to be a little bit of redness.
Definitely, she's going to be red for a few hours. Usually I say for about the day. We do tell everybody there is downtime of a few days, but realistically what we've been seeing for the last year and a half is our patients the next day look great. So when I get the treatment done, I'm very, very responsive to treatments. I show redness really, really quick. But the next day I look like $1,000,000. You wouldn't even know I had the treatment done.
Awesome. Okay, so kind of like a really deep exfoliation is kind of how I'm seeing this with the micro needles, right? Tiny, tiny little needles.
Very similar, and what it's doing is it's going to induce collagen, tighten the skin, and decrease any fatty tissue. So a lot of people have jowls, so they like to get rid of those.
Yeah, how does this help?
In the skin as well. So any crepiness, jowls, pigmentation is going to take those away, fine lines and wrinkles.
Okay, because a lot of people struggle with the pigmentation and there's not a lot of stuff that takes that away.
Yes.
You know, you can get Botox for your fine lines and wrinkles, but pigmentation, that's something that's really hard to get rid of.
Yeah, definitely. So we tell people come in for Morpheus 8 treatments, then we look at Botox, then we look at fillers. We want to attack the skin first.
Right.
Because that's what we see and it drops really, really quickly.
Okay.
Then we move to the Botox and fillers.
And when someone comes in and wants some information, you guys do consultation?
100%. So we do consultations here completely free.
Okay.
So what we like is our patients to come in, see the clinic, meet us. I want them to feel comfortable, get lots of education, informed on the treatments, because a lot of patients do come in asking for treatment aid, but it's really not appropriate. And we don't know until they come in, and then we explain why it isn't. So once they come in, get the education, we figure out the treatment plan, then we book appointments backwards so they can come in next.
It's like a family environment. I love that so much. Okay, we've got lots of interesting stuff coming up, so don't go anywhere. Stay with us right here on Morning Live. Ah, yes, babies and what they do to our skin, Jacqueline. I love the fact that we're openly talking about baby bellies. We've got cellulite, we've got stretch marks, we've got sagging skin. This procedure, it's going to help, isn't it?
So this is radiofrequency. So what we were just doing the last time was Morpheus 8 with microneedling radiofrequency together.
Yep.
Now this is just radiofrequency on its own. So this is pretty popular, especially now that summer's coming. So we're all trying to tighten up our areas, tighten up our necks, tighten up our stomachs. We're getting into bikinis, all that fun stuff. So what this does is actually it's heat with the laser machine. It's non-invasive, no downtime. I do find some patients are a little pink for about 2 hours after the procedure because it is heat being applied to the skin. But what it does is actually decreases subcutaneous tissue and it tightens the skin. So this is the one where you need to do about 8 to 12 treatments, I'll be honest with you. You come in once a week for about 20 minutes, but it's very therapeutic. It feels like $1,000,000. It feels like a spa-like experience as opposed to getting a medical grade experience because of the heat.
Well, the whole environment is very spa-like. A lot of medical clinics kind of are popping up, but they're very static. They're very cold. You know, this brings such warmth to the environment.
So one of the things I always say with medical clinics is our medical clinic is a spa-like experience because we try to keep those warm colors, but our floors are medical clinic standards. Our counters are medical clinic standards. So we make sure everything is sterile, even though it doesn't look sterile. I always say try to watch the medical clinics and what machines they're using. So today this one is Sharp Light. We've used Morpheus before. We had those ones in mode. So making sure that the machines are appropriate, that they're Canada.
Canadian machines?
Yes, they are not They're not from China, they're not from Korea. We're buying them actually from Canada. They're Health Canada approved. Anything that we do here is Health Canada approved. We do not use anything off label, and we make sure the treatment's appropriate for you.
And not diluted and not...
Definitely not.
Yeah, because you hear a lot of things in the news that, you know, these Botox clinics or whatever, they go out of business because they've been found that they're...
So we have a lot of patients come in where they've had treatments before with minimal success, or they've had a lot of contraindications, a lot of issues, and it's because I always tell them, please watch who you're going to, ask what education they have, how long have they been doing this, what products are they using, do they dilute things in front of you, are they bringing out the products in front of you?
Right.
There's lots of different factors. How are the follow-ups? So we always tell our patients, our relationship never ends at the door. One of the things is if they need me for anything, they can get a hold of me through many platforms.
Everyone's firing up your phone, texting you. Jacqueline, I need to come in for this.
That's right.
Yeah, that's
and I always
awesome.
say our relationship never ends at the door, and no question's a silly question.
Yeah.
I said if it's bothering you, then please reach out to us. You are
That's
not bothering us
amazing.
whatsoever. This is what we're here for.
Yeah.
We're a big family here.
I love that.
And we have really good relationships with our patients.
Okay, so what can our patient here expect to see results-wise when this is done after 6 to 12 treatments?
So immediately today, she's going to feel a little bit tighter.
Okay.
She's going to see a bit of results, but she's going to see a decrease in the tissue. She's going to see tightening in the skin.
Amazing.
So that's really our goal there. So I've got
love
it
it.
done a few times. You have a few kids, your skin's not
Right?
tight.
I know. This stomach could be my stomach. If I wasn't standing up, I could be like, hey guys, check out my tummy.
We've done everything we can. So we've worked out, we've dieted, we've done all we can.
Yeah.
At this point, now this machine is going to help you get that little bit of an edge off that you're missing.
Amazing.
Yeah.
Okay, coming up, we're going to do a little bit of a lip flip. I know, I didn't know what it was either, but that is coming up. But for now, back inside of the studio. Okay, we are here with Patricia, who is just about to do a lip flip on Sharon, and I've never heard of a lip flip. I've heard of lip fillers. I've heard of getting kind of Botox in and around the area. What's a lip flip?
So a lip flip is Botox in the upper lip.
Okay.
So a lot of patients come in and they think filler, filler, filler. Social media has become so vast lately, and there's been a lot of misinformation out there, and they just kind of radiate to one's treatment. So this is why we say please come in for a consultation, because filler isn't always the way to go.
Okay.
So what Sharon's getting done today is a lip flip. So what we do is we put Botox in the upper lip, and what it does after a 2-week period, once the Botox kicks in, it softens that upper lip muscle and it brings the lip up. So it gives you more visual lip show without getting filler and adding that volume.
Oh, okay.
Yes.
And what about the little tiny wrinkles that people get on their lips?
So that's another one. So
Because I know a lot of smokers would complain about the tiny little...
Even aging or genetics. So a lot of people do get all those lines in their upper lip. Now, when we do a lip flip, it actually softens the muscle, which softens those lines, and a lot of people actually takes them away. So and it's a very cheap alternative. Not for good. Botox does not last forever. So it does kick in 2 weeks, and then we do say it does last about 3 to 5 months. So a lip flip on the upside is it's only going to last about 6 to 8 weeks because we're constantly manipulating that muscle.
Right.
So people that do get lip flips do come see me more frequently. However, it's a nice alternative. It's pretty price range reasonable.
Yeah.
And it gives you
Compared
a
to a
natural
filler.
look. So a lot of people, it doesn't look like your lips are actually done, which is really, really nice. So
And
I get a lip flip all the time. I don't get filler in my lips.
Yeah. Does it hurt?
It's a little pokey, I'll be honest, but it's
Do you
really, really
freeze?
quick. If the patient asks to be, but it's only about 4 little pokes, and it's the smallest needle we possibly can use, so patients are pretty comfortable. Usually when I'm done, because they're usually sweating in the chair, a little nervous. However, when I'm done, they're really happy, and they're like, that didn't hurt at all.
Yeah. And they don't see you don't see the impact right away.
No, you don't. I wish you did.
And you don't look in the mirror and go, oh, that looks great. You're kind of like, I look
Right.
exactly the same.
And minimal downtime as well. So Botox does take 2 weeks to kick in. When we look at a filler, that's an instantaneous. But then we're looking at bruising and things like that. With Botox, realistically, there's no downtime. So
Why
a lot
does
of
it
my
take so
patients,
long?
because it has to go into the muscle, integrate, inject the protein, and that has to soften the muscle because that's what it's doing.
Okay, because the muscle's tight.
You
and
got
then
it.
it has to relax.
And
it.
every
I get
time
it.
we soften muscles in our face, they move different directions. So that's how we get lifts in our eyebrows, and that's how we get softer foreheads and fun things like that.
Wow.
So a lot of education is needed, especially when you're getting things done. They are medical procedures, and there's a lot of education that's needed, so you know what to do.
Can the Botox in the muscle ever go the wrong way?
Not generally if it's injected appropriately. So again, this is one of those pieces where I state, make sure you're going to a licensed healthcare professional, make sure you check their credentials and how long they've been around.
One eyebrow like way up.
Lots of education, and please follow our post-procedure rules. We are very strict
there
on
for a
those.
reason.
That's right. Yeah, so if you follow those, we don't have complications in the clinic generally, so which is really, really nice.
Okay.
Because patients are really great with
All right. Well, 4th Avenue Medical Aesthetics is where we are, and we've got some exciting stuff. I think they're actually going to put me under the Laser something or other.
We're going to do a luxurious facial with the LED light.
Oh, LED
Yeah.
light. Okay, good. No laser treatment. I was a little scared there for a second. Much more coming up on Morning Live. Oh, I love my job. My job's the best. I'm getting a facial right now. This is amazing, Jacqueline. What's happening?
So what Stephanie's doing is she's doing a luxurious facial. So what we do is we do many facials in the clinic. Depending on what your skin type is, what we're trying to target. We do a lot of acne therapy for teens, and of course we do pigmentation. So the nice thing is all these medical grade facials that we're doing, Stephanie does a full-on massage. So you get a face massage, shoulder, neck massage as well. And then when we're finished with that, Stephanie's gonna put the LED light over top. So that's gonna help with pigmentation, fine lines as well. For kids and teens that come in, we like to put that on as well because it kills the bacteria. So it's really beneficial.
And Stephanie was mentioning that different lights do different things.
Definitely. So we do have all different lights, different colors. They do stay on for different lengths of time. So they do target pigmentation, acne, fine lines, things like that. So yeah, so we do put this as part of your facial if you want to have it on as well.
Oh my gosh, this face massage is so good. I'm like, do I still need to work? Oh yeah, I still need to talk, don't I? You've got a big open house coming up that people are welcome to come to.
Yeah, so May 27th, we have a social. So we do this once a year. So we have giveaways. Of course, the first 50 people that come in, we have baskets and bags for them. We have specials on that day. We have live demos, champagne. It gives everybody a chance to come to the clinic to meet us and to see what the clinic's all about, ask questions, and of course, get some yummy treats and get some specials for the day. So that's May 27th from 1 to 5.
Okay, amazing. So you're giving people like me who don't necessarily know much about the world to come in. Now, I know a lot of people are concerned about perfection. You know, you see something on Instagram, you see a certain model or you see a certain look and you're like, I want that. People probably come in here and say, I want to have lips like Julia Roberts, or I want to look like, you know, the latest YouTuber. I'm sure that happens.
Definitely. So what I'm finding profoundly is that social media is just taking over the world at this point. So, and I've been privy to it as well, where you're seeing social media and there's lots of filters. And what the concern is, everybody's trying to get to this level of perfection. And I think what it is we're just so hard on ourselves because we're seeing social media and all these filters and pictures and comparing ourselves. So I'm finding a lot of women are coming in trying to get to that level. And what we're here to do is everybody's beautiful. We are beautiful in our own ways. A lot of these are filters. They are for show. They are for TV. They are for Instagram.
Yeah.
However, what our job here is just to fix those little things that people are having issues with in the mirror, just to make you feel confident. So the nice thing is with our patients, they come in, we gain relationships with them. I know everything about them.
Yeah.
We talk about their kids and their lives and new jobs and what's going on, and they know everything about me. So it's a really nice experience coming here. And I love my job. At the end of the day, I'm just completely thrilled leaving here. The text messages, the reviews have just been beyond over the years, and it's just fulfilling, that's for sure.
I love your job too. I really do. We've had such a great time here. It has been super enlightening, very educational, and you're right. Everybody is beautiful in their own way, and there is no issue if you want to get any of this stuff done. Just, of course, come in, be educated, and know exactly what you're doing before you do it. Thanks so much for having us, Jacqueline. We've had such a great time.
It was great.
Oh, here comes the light.